I will now demonstrate an intravenous laser blood irradiation with the Weber needle endo laser system. I will, in the first step, puncture the vein with a small butterfly, and later we will insert a fiber optic sterile laser catheter for irradiation of the blood directly in the vein. So I prepare the arm of my patient now for the punction, and I'm using now a special butterfly which is not available on the market. It is a product from Weber Medical. You see that the butterfly has a special lure lock connector, and I can attach a special small tube in which I can see the blood running back if the punction of the vein was successful. I loosen a little bit the cap at the end so that the blood can run back, and I can prove directly if the puncturing of the vein was okay. So now small peaks. And you see that the blood is running back in the tube prolongation, and now I'm sure that I have the butterfly in the right position. In the next step, we will fix the butterfly with a small tape. Besides butterflies, we also can use plastic cannulas like Braunulas from Braun-Melsungen. Every doctor knows this, which has the big advantage, of course, that the patient can move his arm better. And now we have a metal needle, so it's important that the arm remains in a quiet position. So I open now the sterile catheter. You see that the end of the catheter is still protected with a sterile tube. So I disconnect now the tube, and I see that the blood is coming out of the cannula. And now I insert the sterile end of the catheter, and then I can fix it with a special plastic screw. Now I have a closed system, and no blood can run out anymore. So the needle is now well fixed, and in the next step I will connect the fiber optics of the laser modules with the catheter. I'm using in the first step the red laser as the glass fiber cable inside, and there's a special connector at the end of the cable in which I insert the end of the fiber optic catheter. The diameter of the glass fiber and the catheter is 0.4 millimeters only, and you see that we are using special glass fiber optics for the catheter from plastic material to make sure that never can break anything in the vein. So I switch the device on, and you can see how the red laser is shining through the skin. It's always an amazing effect for the patient, especially if you switch the light off. So I show you now more exactly how it works in the dark light. I connect again the fiber optics of the device with the plastic fiber end of the catheter. And you can see this amazing effect that the red light is shining through the skin. The reason for this is that the red blood cell, of course, reflect the red light, and therefore we can see it from outside. On the other hand, the main effect of the red laser is that it is absorbed mainly by the white blood cells, which leads to a great immune stimulation of the different immune cells like lymphocytes, macrophage, monocytes, T and B cells, and other components of the immune system. I attach now the green laser, and interestingly we cannot see anything. That means that we have 100% absorption by red blood cells of the green light. Only if I stop the blood flow, I can see a little bit green light shining through the skin. But when the blood is flowing again, we cannot see anything. So the green laser leads to a 100% uptake of laser energy on red blood cells, which has, of course, leads to a great energizing of the human blood. And also we know that the blood treated with green laser can uptake about 20% more oxygen. We have the same effect with the attached blue laser, so also there we have nearly about 100% absorption by red blood cells. And the main effect of the blue laser is that it leads to like an antibiotic effect in the blood and brings more free nitric oxide in the blood, which is normally bound to hemoglobin.